Important point. Define. Historical background. A BC model of CBT. CBT Triangle. When CBT is used, CBT technique. CBT is a widely recognized and evidence-based form of psychotherapy or talk therapy that focuses on identifying and changing unhelpful thought patterns and behaviors. CBT is based on the premise that our thoughts, feelings, and behaviors are interconnected, and by addressing and modifying negative thought patterns and behaviors, individuals can improve their mental health and well-being. CBT is typically a short-term, goal-oriented therapy that helps individuals learn how to recognize and challenge irrational or distorted thoughts and beliefs that may contribute to emotional distress or mental health issues. Historical background. Cognitive behavioral therapy emerged in the 1960s and 1970s as a significant development in the field of psychology and psychotherapy. It was influenced by the work of pioneers like Aaron Beck and Albert Ellis, who emphasized the role of cognitive processes, thoughts, and their impact on emotions and behavior. CBT integrated cognitive and behavioral theories, focusing on identifying and modifying irrational or distorted thoughts and behaviors to alleviate psychological distress. Over the years, CBT has become one of the most widely practiced and researched forms of psychotherapy, with a strong evidence base for its effectiveness in treating various mental health conditions. A BC model of cognitive behavior therapy. The ABC model is a fundamental concept in cognitive behavioral therapy, CBT used to explain how thoughts and beliefs influence emotions and behaviors. The model is often used to help individuals understand the connection between their thoughts and their emotional and behavioral reactions to specific situations. The ABC model stands for I. Activating event, B. Beliefs, C. Consequences, A. Activating event. This represents the specific event or situation that triggers a person's emotional response. It could be a real-life event or a thought or perception of an event. B. Beliefs. These are the beliefs, thoughts, or interpretations that the individual assigns to the activating event. Beliefs can be rational and balanced, or they can be irrational and distorted. The focus of CBT is on identifying and challenging irrational beliefs. C. Consequences. The consequences are the emotional and behavioral reactions that result from the individual's beliefs about the activating event. These consequences can be positive or negative, and they often include feelings like anxiety, sadness, anger, and behaviors like avoidance, withdrawal, or taking action. CBT Cognitive Triangle. The CBT triangle is not a standard term or model used in cognitive behavioral therapy, CBT. However, I can provide an example of how a triangle could be used metaphorically to represent key components of CBT, including thoughts, emotions, and behaviors. Thoughts. This corner represents your thoughts, beliefs, and interpretations of a situation. For example, let's say you have an upcoming job interview, and you're thinking, I'm going to fail. I'm not good enough for this position. These negative thoughts are at the thoughts corner of the triangle. Emotions. The second corner represents your emotions or feelings. In the job interview example, the negative thoughts can lead to feelings of anxiety, self-doubt, and fear, which are at the emotions corner of the triangle. Behaviors. The third corner stands for your behaviors or actions. In response to the negative thoughts and emotions about the interview, you might start procrastinating or avoiding preparation, which is located at the behaviors corner of the triangle. When CBT is used to treat a wide range of mental health issues, including but not limited to depression, anxiety disorders, e.g. generalized anxiety disorder, social anxiety disorder, panic disorder, phobias, obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD, eating disorders, A.g. bulimia, anorexia, substance use disorders, bipolar disorder, insomnia, borderline personality disorder, chronic pain, Relationship difficulties. CBT technique. Cognitive restructuring, identifying and challenging negative or irrational thoughts and replacing them with more balanced and rational beliefs. Behavioral experiments, encouraging individuals to test their beliefs and assumptions through real-life experiments and experiences. Exposure therapy, gradual and controlled exposure to feared or anxiety-provoking situations to reduce anxiety and desensitize individuals. Problem solving, developing effective problem-solving skills to address real-life challenges and stressors. Relaxation and stress reduction techniques, teaching techniques like deep breathing, progressive muscle relaxation, and mindfulness to manage stress and anxiety. Behavioral activation, encouraging engagement in enjoyable and meaningful activities to counteract depression and increase positive experiences.